Knowing what we know, which there is so much evidence, is that climate change is going to be disastrous for human health.
Really often when you're a doctor passionate about sustainability, people get the idea that you don't necessarily want the best for all patients. But I do this, and I am passionate about this subject because I do believe that this is how I can improve my patients' health the most.
I think this is very motivating because you see this momentum that it's gaining.
Can you give me advice where to start reading, for example, how to get into this? Welcome back, everyone. Today I'm here with Luise Bödecker and Lukas Radema. They are both part of a relatively young research group on sustainability in healthcare within the University Medical Center of Groningen in the Netherlands. Luise has been active for multiple years within different positions on regional and national level of IFMSA, the International Federation of Medical Students Associations, and has there also been part of Act for Health, a national working group on climate change and health. Now she is working as a junior doctor on the ICU, and besides that doing her PhD research, which ranges from perceptions of sustainability to evaluation as well as improvement of the environmental impact of particular surgeries. Lukas' research also focuses on sustainability. He has, for example, developed the Afval Accord, a convenient free tool to help other surgeons and hospitals to review and reduce their waste production in different procedures. He is co-founder of the Green Care Research Collective and not only a physician and researcher, but also obtained a master's degree in philosophy, which gives him an interesting additional perspective on different issues in the field of medicine. Welcome, and thank you both a lot for joining us here on the podcast.
Thank you.
Thank you.
You two are research colleagues in a field that has a lot to do with personal passion. So to get to know you a bit, I would be interested if you two can share one thing that the other one is very passionate about.
Does it need to be related to sustainability?
Not particularly, no.
Okay, so I do know that Luise is very passionate about making her own sweaters.
Ooh.
She's wearing the one right now. And I think this is also a very sustainable practice. So I think it's still relevant for this podcast.
Yeah, thank you.
A very nice thing. We'll send a photo along with the podcast so people can admire your knitting skills.
I would love that. And for Lukas, I think thinking and criticizing inequalities, and that relates back to the research, but also societal phenomena. So I think that's a one I see you thinking about a lot and criticizing a lot.
Luise is passionate about a lot of topics. Now that she mentioned this, I feel like I should mention that Luise is very passionate about many large societal topics, about injustice, and she becomes very, very passionate when it regards problems that she thinks need solving, and that's can be very broad. Yeah.
Nice answers, especially the thinking part fits with a philosopher as a background, but both of you a passion for solving problems, solving inequalities, and of course also sustainability, I guess, because otherwise why would you do research about it? So at least that also answers about the question about why the both of you got motivated to do research in the field of sustainability. I guess you want to change something, right?
Yeah, for sure. I think it is quite a young field of research. There's a lot to win. There's a lot to still figure out. But it has big chance. Yeah, it has a chance to impact, has a lot of impact on the daily life in the hospital.
Mm-hmm.
Yeah, and I think as a young medicine student, at some point you enter the hospital and you have some idea of what it would look like. But I think for many people, there is a period where they see all the waste that is created in the hospital. This is very visible. Almost all of the things you use in a hospital nowadays has become disposable. And once you've touched it or opened it, it needs to be thrown out. And I think there is this period probably for most students where they are quite surprised by this. And then this period ends at the moment you start to get used to it. And then at some point you even start to think this is how it's supposed to be. But I think if you, within this period, step out and think, isn't this a problem? Shouldn't we do something about this? I think this is where me and probably Luise have ended up doing research on this topic.
Do you think everyone goes through this phase, or is this connected with a special personal interest?
I don't know if everyone goes through it, but I think it is a widespread phenomenon that medicine students at some point think, that's a lot of waste after one surgery, for example, or just the... it's also quite colorful, the hospital waste. It's very blue often, so it is very visible. You have this blue packet, and then at some point you throw it away. And I think most people probably at some point have had some question marks about it, but probably not everyone.
Yeah, I think what really is, in my opinion, the problem is that you grow into a culture where this is normal. Where it is normal when you enter a patient room to, first of all, put on gloves. Even though you might not even touch the patient, maybe the patient doesn't even have a big operation where you actually need to have gloves on to examine the patient. So I think it is a culture you get thrown into as soon as you step a foot in a hospital. And it's hard to unlearn, learn that culture.
Definitely. And there's a pressure as well. There's nobody who tells you, or, I mean, if me and Luise are near, maybe, but normally there's nobody near you who is going to say you should not be wearing gloves. But if you've made up your mind and thought gloves are not necessary for this, what I'm doing right now, and that someone there might actually say, well, I think it is. And then you have this like little conflict, which you probably do not want, especially as a student. So in a lot of the times it is easier to just use more disposable equipment because that might actually save you from somebody who thinks it's their duty to tell you you should be doing this or that at that point.
Yeah, for me it was actually a bit different how I got to the topic. As Timo already said, I did a lot within IFMSA. And there I got in contact with the group Act for Health, which we're very passionate about and verbal about, that the climate crisis is also a health crisis. So the subject already was quite close to my heart because I understood all the studies and the relationship between climate and health. And then when I first stepped to the hospital, or as a student, had my first internships, there I was, through the knowledge I had already, was really pointed at all the ways, that all the things we just do for doing them. There's a lot of course, within medicine, a lot of, it's also a culture of just do something just to be sure. And just doing it because we can do it on top of something else. So if you already had that topic close to your heart and you are familiar with sustainability, then that culture shock, I could nearly call it, gets more clear as well. So that helped me to be a bit more critical in it as well.
Interesting. I've a following up question, which kind of relates to that inherent motivation that you had, and you understood the studies, and that climate change is also a health problem. And you said, we go into the clinic as young doctors and we see all the waste, and at a certain point, many of us just accept it. And many of the topics we discuss in this podcast are things you learn. This is how it's done here, which is like the hidden curriculum. And then you could say, using a lot of waste this is how it's done here. Why should we not accept it? And why should I, without an inherent passion, so to say, why should I care about sustainability?
Well, I think if you started studying medicine, I at least hope you have some regard for human health, and you probably have some intrinsic drive to optimize human health. And knowing what we know, which there is so much evidence, is that climate change is going to be disastrous for human health in very unequal ways, unjust ways. But so other countries might suffer even more than we do. But even in the Netherlands, we will suffer very negative health consequences of climate change. And therefore, I think more than any other sector, probably, doctors should feel this drive to at least make their own practice as sustainable as possible. And I'm not even saying that. I think this is very possible without affecting our own healthcare system in any negative way. A lot of it is so unnecessary. So there's so much to gain there still. So yeah, I think if you want to become a doctor or any healthcare professional, you should feel this burden, at least in your own work, but probably even more broadly speaking, you should also be angry with polluters because you know that this will cause negative health effects. So, yeah, and I don't know how familiar the listeners will be with the facts, but the fact that 7% of the Dutch national healthcare, 7% of the Dutch CO2 emissions is emitted by healthcare. That is enormous. Yeah. And that is something we should, I think, combat.
Yeah, and if you globally combine all healthcare sectors with each other, then you come to the 5th biggest polluter there is if you compare it to countries. So in total, it's 4.4% of all emissions we do on this world is from healthcare.
That's a lot.
That is a lot.
And it's growing.
Yeah.
And I think what I wanted to add on what Lukas said, you pointed out that you should change. Should have the intrinsic motivation to change your practice or to be conscious about your practice. I think it all starts with actually being at least open to the topic. So being open to actually learn about how climate and health is related to one another. And when you actually tell people or give presentations about the pure health and climate, how that interrelates to one another and impacts one another, then quite quickly you can go per specialization in the hospital and pinpoint what the impacts are on that specialization. Pulmonology, cardiology, pediatrics. You have specific studies for every specialization. So for me, it starts with being open to the relationship between health and climate crisis, and then you can go on further. But most doctors of other healthcare professionals I had conversations with as soon as they understood the basics of it, and then the studies related to their specialization, quite quickly they all went to what Lukas just said. We actually have to change our own actions. And there's a lot you can actually change in small actions in your own daily practice can make a big impact on the total waste and CO2 emissions, but also on costs, on the time spent for certain maybe unnecessary actions you do. So often it's a win-win-win situation. And yeah, that's mostly it.
So what I hear is that out of a prevention motivation, I should care about sustainability because the effects of climate change directly affect the health of my patients that I care about and that I want to treat. And a cardiologist is the entire day busy with telling patients they should do more sports, eat healthy, stuff like that. But you say that also tackling the consequences or the basics of climate change can also have the same effects as prevention on a personal level.
Definitely, yes. It is, of course, further removed from the situation, which makes it really difficult sometimes to keep your eye on the ball at this, or keep your eye on the prize in this sense, because you have as an individual physician, you have your individual patient sitting opposite to you, and this patient wants something for you, but also trusts you. So there is this very you need to believe that you want to help each other, and the idea perhaps might be scary for some, that the doctor might also be thinking about, well, but I should also be sustainable with how I treat my patient. Yeah. So the good thing is, I think that it very rarely needs to be negative for the patient. It's just about being more conscious and just choosing the right option, which is almost always also the right option for the patient. And of course, telling a patient you should do more sports, that might immediately affect the patient's health more than saying, well, we will probably try to have a a less intensive way of providing care for you by, for example, doing restrictive therapy instead of surgery, because there are certain procedures where we know that restrictive therapy is just as effective as surgery. Yeah. And in that sense, surgery will probably have a lot more negative environmental effect, but probably also for the patient might have more negative effects. And then still we often lean towards just planning in surgery because it feels like we're doing something instead of being restrictive. And then,
that was actually, I also want to say something about that subject, because really often when you're a doctor passionate about sustainability, people get the idea that you don't necessarily want the best for all patients. But I do this, and I am passionate about this subject because I do believe that this is how I can improve my patient's health the most. Yeah. And that doesn't mean that if there's a necessary treatment that is full of disposables or a medication that is with a high environmental impact, that I wouldn't give it. No, but in the choices where it is known, where it is studied, that it's as effective or it is unnecessary, because there are a lot of things that we are actually doing because we're doing them and not because it's proven to be right. It's more a medical culture than actually proven by studies. And that's also about the gloves, that's about treatment, that's about certain medications. We feel like if we prescribe diclofenac, other than, say, you can take ibuprofen, naproxen from the pharmacy you can buy yourself, then we do something more. But it's proven, for example, that certain medications have way more impact on the water quality of a country. So we do something because it feels more like we're actually doing something, but it's not proven to actually help that patient. Yeah. So I think it's very important to realize that if you're passionate about sustainability, it comes, at least for me, and also for Lukas, I know that, comes from a perspective of this will help the health of my patient the most. And not from a perspective like, oh, we're going to stop doing certain treatments that patients really do need. I mean, I'm a doctor on an ICU now. That is very high impact for the patient, for the environment, financially, for the healthcare system. But it is often the necessary treatment. Yeah. But by exactly these high-yield healthcare, there we have to be selective, and we really need to think what gains the patient out of this, and perform personalized medicine and be very conscious about our choices. As soon as we become more conscious, we will quite often, our action will become more sustainable as well.
Yeah. I hear a bit of, I think it's called co-benefits between the lines already. Those are the best solutions, of course, that one, improve the environmental impact, but also secondly, improve the outcome for the patient. And there are many examples that have been tackled already. For example, giving more sustainable drugs, which are actually as good as the less sustainable medications, or giving injections as bolus instead of doing like a short infusion, which is also less fluid for the patient and which is easier for the nurses. So those are very nice fixes. But I guess there are also things where where people think they need to compromise. One thing I had in mind preparing this episode is we are talking a lot about being more sustainable as doctors, being good role models, so we should not fly to congresses anymore, which is a compromise for me as a doctor to not fly to a congress to Tokyo or whatever, which can be a super nice thing to go there. So that is a compromise for me. How do we balance motivating doctors to be sustainable and on the other hand not frustrating them if they don't have an inherent motivation for sustainability or they care a bit less, frustrating them too much that they don't care at all anymore?
That is a very hard question. And it's one we try to answer every day, I think. It's doing research within sustainability is quite diplomatic. And I think finding the way between the lesser evils, that is what we try to go forward, especially flying to congresses or restricting flying to congresses. Because there have not been any rules about how often and how far you're allowed to fly. That is a very sensitive topic. I do think at some point to actually make big impact, we as a healthcare professionals, we need to decide as a group where we want to go to and actually making rules and restricting flying. Also, it is a necessary step, but it's a very delicate one.
I think that's a great answer by Luise. I would just like to add that healthcare emits more than the aviation industry. So yes, this is very difficult. This is something actually, I was quite surprised by how passionate people get about having their flights to congresses perhaps taken away. So I think what Luise says, for me, I think it is not the case that at some point we could never fly to a congress anymore. But I think it being the norm is probably problematic. And there should be more of a awareness about how there are also alternatives, especially when you can, of course, choose your congresses closer to home. If you go to France, you can take a train. If you go, in Europe. But yeah, I mean, I think Luise said it very well.
Yeah, and I think to add on this, this subject or like the example of the flying or restrictive flying regulations is a good showcase for how I often also translate being sustainable to students or to colleagues, or if I give a presentation to the managing staff. What for me is important is if you understand the basics, so human health is related or is impacted by climate and climate change. If you understand that part, then I don't expect human behavior, study of human behavior and changing human behavior is quite complex. So I don't expect from just giving you that knowledge to actually immediately change your life completely. That would be wonderful. But that's not realistic. So actually choosing your own battles, realizing where you emit as a person, but also as a healthcare professional a lot, where you can improve day to day, your environmental impact is the most important. And it starts with being conscious. If it's that you usually went to a congress and flew there 5 times in 2 years, maybe make it 1 time. Mm-hmm. If you use certain surgical instruments and there are disposable options, go to your manager and talk about the options to implement disposable ones. So choose your battles, and you don't need to go from 0 to 100% sustainable practice, but be conscious about the choices you make. We don't need to go to no congresses ever again, but maybe go to the congress where you actually have an active part in. And so you can, like that, you can use that example to all the more sustainable practices in the hospital.
And also just stepping away from the flying to Congress a bit. But I think it's important to realize that there is no optimum sustainable way of living. We're all hypocrites. We'll all make choices which are unsustainable at some point.
Absolutely.
And this is okay. But I think making those choices should probably be something which you've thought about at least, and at least thought over, is me being a hypocrite right now, is it worth it? Mm-hmm. Because sometimes I make choices which I think this is not sustainable, but at this point it is necessary for me. And in that sense, I at least think this is okay. You cannot be some kind of 100% sustainability representative and always make the most sustainable choices, but probably most often you can, but not always. Yeah.
If you ate meat every day in the restaurant for lunch, maybe reduce it. They have vegetarian options, and also there the changing from 5 times to 0 times. If you are manage to do that, perfect. But if you just step by step decrease it, it's good going back to the co-benefits for your own health, but it's also good for the environmental impact. So it adds up.
Yeah, and it fits with the identity of a doctor, I think.
Yeah.
Making health, promoting choices.
Yeah, being a role model. Yeah. And I think that's also something that going back to curriculum is something we kind of learn as soft skills here to be a role model, but also realizing what that actually means, like being a doctor, the societal role of a doctor, the signaling function. I also see, due to that, because of that, I do see that my passion for sustainability, I see it as a responsibility as well to signal that I'm worried about human health. So I do think if you know enough about the subject and you know about the unique role a doctor has in society, you have the responsibility to speak up.
This partly also answers a question I just had in mind, which is I'm still asking the question because it's asked a lot in the debate on sustainability, I guess. And it is, you say, I as a doctor should be aware of my own actions and improve my own actions wherever I feel it's possible. However, the entire healthcare system contributes in the Netherlands 7% of the CO2 emission. Why should not the system be more responsible for it? And why am I responsible as a doctor and not the leaders, so to say?
Yeah, it's the age-old bottom-up, top-down discussion, exactly. Right? Who will tell who that the system needs to change? I think it's both. I think that's actually, for me at least, an easy answer, but not an easy solution. Mm-hmm. I think there's definitely going to be top-down regulations needed to make this transition easier. But I think bottom-up, also what we've seen in the UMCG, having the right voices who represent this idea, and also because I think it's such a rational idea, right? We are all trying to benefit health. Climate change, the Global Health Organization has named it the biggest threat to human health this century. Mm-hmm. This is not just some health threat. This is enormous. Yeah. I think that's such a rational idea. Well, we are health professionals, so we should combat something which is such a big threat, that having the right people from the bottom up transmitting this idea will generate momentum and also create system change, because these people are, when you distill it, the system for a large part. So I think it's both. And it's also about being more sustainable professionally, which is something we've discussed. And maybe, you're a doctor also if you're not working, right? You're always representing being a physician in some way, at least. Mm-hmm. People look at you who know you as a physician. So in private life, probably you should also make at least some sustainable choices. But in professionally, I think it is almost should almost be feeling as part of your duties.
Yeah. This is a question I'm actually in my research. I'm not really trying to answer it, but I try to find somehow a solution or a methodology to answer this question. How do we actually can we cause system change?
Mm-hmm.
And how do we do that in a complex organization as a healthcare institution, like this big university hospital? And there are so many wonderful people that have been, for years, have been pouring their heart out for this subject, and they're setting up initiatives and projects, and have been working very hard to actually make sustainability an important subject. And what we see now here is that actually the culture of the top layers changing. Managers are actually getting interested in the subject. So right now we're looking at a method to actually combine all those initiatives of all those people who have been very motivated to drive this transition, to formate it together to actually cause a system change that you can track and that you can work further on, so that we go from small projects on all different wards to actually a whole plan that in a couple of years changes how this hospital operates. But that's really, really hard. How do you make a plan like that while also providing all the care you usually give? How do you fit in sustainability in already very busy day? And what I noticed slowly now is people first thought that sustainability is just putting on glasses, and then I look through them in my sustainable way.
The green glass.
The green glasses. But what actually has to happen is that it's just part of how you look at certain things. So as the healthcare system always looks also at financial costs and above all patient benefits, there should be one small perspective that is also sustainability. And if it doesn't matter financially, time-wise, and especially not for patient results, then sustainability should be a factor that you actually consider and that you take into your equation. And to get there, system change and a lot of behavior changes, culture change is necessary.
If I may add one more thing.
Sure.
We shouldn't underestimate bottom-up change, I think.
Mm-hmm.
Very, very much true.
There is this lovely example somebody told me last, which I think is very relevant to our case. It is about the Netherlands, but even more so in London and Paris, where in the 19th century, a group of physicians, calling themselves the hygienists, these were physicians who were treating patients every day, and they were seeing that these patients were getting sick by their environment, by having bad hygiene in public places, very inefficient sewage, a lot of, just dirty streets making their patients sick. And these hygienists, they used their voices to, in London and Paris, create the large sewage systems that are still in use, and in the Netherlands also to a lesser extent, but changed policies because they were physicians. These are trusted voices speaking about public health, which is their expertise. And these bottom-up people, they changed the way our system functions. So this is, I think, very possible in our situation as well.
Yeah, you can't create system change without having the bottom with you.
Yeah.
And what I've seen here, and that's also what motivates me and drives me, is seeing how, within a couple of years how an organization can change. And we're talking about an organization with more than 10,000 people working here. So this is an incredibly big, system we interact in, and seeing that change gives me a lot of hope. And we're really accelerating right now.
Yeah. That's a nice note, because it can be a very frustrating topic, of course, that you have some optimistic views on it as well. I want to get a bit into the perspective of students, because our podcast also addresses students. And I was curious, do we need to teach this? Do we need to educate people on planetary health? If yes, how?
Yeah, I think if you go to medical school and medicine is taught in a certain way. And if we simply start with what I already said, human health and human health doesn't exist in separation to its environment. So human health in climate, its environment, if you learn that, that in my opinion starts with the definition of health already. Mm-hmm. What is planetary health? What is human health? How is it related to one? And then you can go by subjects, by specialization, and learn how human health and climate crisis is related to another. And if you have that as a base, then you go to how much impact has the healthcare system on the environment. And then we can think about climate change, about CO2 emissions. We can think about clean water, biodiversity. So that if you learn then the impact of the healthcare system, and then you already, because you're starting to develop to being a doctor, you slowly learn that, in the future you have a role model role. Then combining those three things, I think, gives the students the tools to actually be verbal about it themselves, or at least being informed enough about it that they can make their own choices. But I'm also very passionate about getting this into the curriculum. It is in the curriculum now. So it's been a journey. But I think it's very important to learn not only about sickness, but also about health and how health is related to the environment for students. Because we do not exist on a little island where nothing else is. We need our environment, but we can also get sick from it, and that we need to learn.
Do you by chance know how this is internationally? Is it in different curriculums already, or you can also say that you don't know that?
I know in the Netherlands it is starting to be implemented, not only for medical students, but all healthcare related curricula in universities. And internationally, it sometimes is taught as a separate subject, and then it's more related to public and global health. And planetary health comes sometimes in the curriculums when you talk about the definition of health. Yeah. But actually really making it a subject within medicine is rarely done, to my knowledge. But I also don't know the developments of all countries the last 1-2 years.
What would you ask from educators, faculties? How should they implement this?
I think it is about, of course, explaining this idea. Like Luise said, I think Luise gave a very comprehensive way of telling this story, actually. And the idea of planetary health, the idea that you being a doctor for an individual patient actually might affect more than just the two of you at that moment. I think, it is difficult, right? Because you're educating people to fit into a system, and it is the system that we are trying to change. So this is not going. I don't have a clear-cut answer for you. No. I think this is something you also need to discuss with students. These students, they need to be cut some slack as well. Perhaps if they do not understand it fully. But that's again part of the system. But I think the system should also offer the students some room to change them. Right? If the students are coming in with these new ideas about planetary health, the system should be open-minded to hear them. And in this case, they can help each other to understand it better. But I think I cannot really add more than what Luise has already said. I think that's very comprehensive.
Yeah, I think because I've been interested in and engaged a bit in the process of, we wanted the curriculum, but how are we getting it in the curriculum, and how will we translate it into actually education for the students? How does it relate back to the lessons the students will have, and who will teach it? Yeah. Who is an expert on this subject? And I think really important for this subject is to realize you don't have to be an expert on it. Having a discussion, having a couple of open questions about it, having the base knowledge about human health and climate, that often is enough to actually spark the ideas and have a good discussion. Because with this subject, because it's such a hotly debated subject, it is good to have discussions, and they can be they can go in all directions, and there can be students that are very opposing and then students that are very passionate about it. But that interaction, that is super important. So I think there's not one fits all solution, but should be taught as any other subject as well in med school.
And I think the impact would be maybe highest if they also hear it from future colleagues. Yeah. So hearing it from medical professionals, from physicians, this is actually part of your job, or at least it should feel like part of your job. That will be very important, not just people who are focusing on sustainability. I'm not saying that because those will be experts as well, but I think hearing it from physicians will have a high impact.
Yeah, and I've been giving sessions now about exactly that background, basic knowledge you need to give students for a while now, and I don't know all details of all studies at all times in a session. So if there's a student with a specific question about that one study in pneumonology, it's also okay to say, I don't know it exactly. Yeah. I will look it up for you. I will give you the details. We can't always know everything at all times, and putting that on sustainability, I think is not a good idea. So understanding the basics and being open about it, having discussions about it, that's the most important, I think.
So as a starting point, essentially first creating a room to discuss this topic and to make it clear that this is part of being a doctor, because it is like super directly concerned to health outcomes. And if I think about what you said, it's also maybe an idea to implement it not as one course, which is purely about sustainability, but maybe even implementing it as one of the standard things in every other course. So if you talk about, we had cardiology, so let's take something different. If we talk about nephrology as a subject, then also talk about the climate and nephrology, and not just these are the symptoms, these are the diseases, these are the lab values, but also these are the environmental concerns in nephrology. So
that would be ideal
to implement it in every.
I think, ideal, but also very sensible.
Yeah.
Because I mean, it makes little sense to me, at least, to ignore the health of certain people regarding a therapy. Because this therapy is helping one individual but might harm other individuals. Why should we focus on the one individual and leave out the other individuals which might be harmed? We know how much CO2 will harm one individual. This has all been researched. It can be calculated. So, it makes little sense to me to ignore the public sphere when talking about individual care.
Yeah. I think that is a very holistic way of doing it. For me, it would be the ideal way, because health is holistic. As I said, the human doesn't exist on a little island away from all environmental surroundings. So, I think talking about it within every subject is the way to go to actually create also system change.
Yeah.
Because then it's just part of how we do healthcare.
Yeah. And I think also, Lukas, what you said is a very good point, that we don't per se need to invite an ecologist or whoever to give like a super informed talk to students, but maybe it's even better if they hear it from different lecturers who are actually doctors. So if I as a student sit there and I know I'm not at all interested in psychiatry, so that we discussed with the psychiatry that planetary health is important for mental health, that might not touch me as much as, for example, I want to become an anesthesiologist, and the lecturer who is an anesthesiologist tells me, okay, we are really concerned with using narcotic gases and we don't want to use them anymore because they have such a big greenhouse gas effect. And I hear, oh, those people that I identify a bit more with, who are kind of role models for me, they also are concerned with this topic. So this is also maybe a direct advice we can give to every listener who is a bit concerned with education, that even if you are not an expert on this field, you are allowed and you are invited to include this in your lectures.
Absolutely.
And that doesn't only help the student, but also the lecturers. And by that, we also get more and more people that read into the subject and that knows a small bit of the bigger picture.
Yeah.
To get it more complete. Yeah, I think that would be wonderful. And then there are subjects in medicine, thinking about virology, for example, where I think there has to be some part of planetary health / environmental impact of health and the climate crisis.
Yeah, because
it's so closely related to how we in the Netherlands get more borreliosis, how we get certain viruses more now. That is a subject. So it for me, those you can't take apart.
No, it's
so it has to be talked about.
Part of the subject. Yeah.
And I think now that we're becoming more close to the end of the episode, I think I can also introduce some philosophy here. If
Please.
That's all right. Well, it's not going to be very advanced philosophy, but it's also a question about, doesn't the patient have the right to know the effects of their treatment? We're always going on about informed consent, about respecting the autonomy of the patient. Of course, there's 4 principles in healthcare which we swear an oath to. We need to respect the patient's autonomy. We need to do no harm. We need to do good, to have beneficence in our job, and we need to be just in our jobs. These are the 4 principles that we swear an oath to. And this respecting the autonomy of the patient, informed consent, shared decision making, is often seen as this very individualistic concept. The patient needs to be informed about everything which regards them immediately. But I think, me at least, if there is a treatment, if I have 2 treatment options and they are almost similar, maybe one is slightly better, but this slightly better option has way larger environmental effects, I think I would choose the other option. Yeah. So I think withholding this information from me harms my autonomy. So there is this idea, this philosopher, Christina Ricci, she's called, she writes about green informed consent. Mm-hmm. Which is the idea, and I'm not saying I fully agree with this, but I just want to introduce this idea. It is the idea that before you discuss a treatment with a patient, you should first get to know the patient a bit, get to know their values, and then from their values, actually deliberate what this patient wants to know. So if this patient, within the talk about their values, tells you, well, yes, I find the environment very important, that makes it that respecting their autonomy also means that you give them information about the negative environmental effects of the treatment.
Yeah, as much as we give information about how effective something is or
side effects,
logistical implications some treatment has, coming to the hospital every other week, for example, or time investment and treatment can have, why don't we talk about this as well?
So, does the patient have a right to know? Maybe, maybe not. I think I would like to know at least.
Yeah,
same.
Me too.
Yeah.
Interesting food for thought.
Yeah, and all the other quality criteria we swear on, first do no harm, that directly relates back to the subject as well. Because that is why I think we have to do something as a healthcare professional. Yeah. Because we have to act more sustainable.
I want to cycle back for getting a good closure of this episode to some optimistic ideas. I think this is already a quite optimistic talk, but it can be a very fatalistic topic. And I would be curious if you can give like just a few short examples of things that have changed. Luise, you already said that you see the system changing a bit, but can you give some good ideas that keep me optimistic that we are going into a good direction?
Definitely. I think within healthcare in the Netherlands, at least, I don't know how it is in different countries, but in the Netherlands, I think healthcare is becoming more and more sustainable. And I think also it finds sustainability more and more important. It's getting implemented in different hospitals. Hospitals are setting up teams in the UMCG, where we are right now in Groningen. This team a couple of years ago was only a handful of people. And now there is a couple of dozen people working on this topic, not full-time, some full-time, me full-time, for example. But there are so many more people who are focusing on this because it makes so much sense for a healthcare institute to implement sustainable practice. So I think this is very motivating because you see this momentum that it's gaining. And this is not stopped by any political direction the country is headed in. This is such a idea that healthcare institutes grasp onto because it makes so much sense that I don't see it stopping anytime soon. So yeah, I think it's very optimistic in that sense.
Yeah, and I think very important that you mentioned that this topic can be demotivating, and that it can. I struggle with this sometimes as well, but most of the times I'm quite optimistic, and it's usually because of the people I encounter. Mm-hmm. And sometimes you have those conversations with senior doctors, and even if you feel like you talk against the wall, a couple of weeks later you meet them again and you have another conversation, and then all of a sudden you somehow sparked something in them. So the first encounter sometimes is very different from what the impact you may actually make. So that motivates me a lot of times because within the last 2-3 years, I more often had that reaction. So first I thought, this conversation, that didn't go too well. And then a couple of weeks later, I encountered the same person again. And then they actually come back to me and they have a couple of questions and they become motivated and they talk with their family about it or their kids. And all of a sudden, they're quite motivated. And the people of my team or our team within the team that helps me a lot, and how much we get done and how much change is happening here. And also just, realizing a couple of projects and then seeing how much environmental impact you can save by flipping very, very small switches.
Yeah. And I think we shouldn't forego the fact that we, right now, are a significant part of the problem of climate change as healthcare professionals. But I think we have even larger potential to be part of the solution for climate change as well. Telling this story, changing ourselves, but also changing our larger system more than just healthcare. Standing up against pollution, which kills millions of people every year. Standing up against fossil fuels, there is a large amount of topics which affect health negatively and which also further climate change. And I think that we should feel very motivated by this. We can be the solution, I think.
Yeah, as much as society is changing now, the more important it gets, I think, to signal in this world why we have this passion and why these subjects will impact health of all people. Yeah, and students. For me, students are very motivating and make me very optimistic. Giving sessions to students and afterwards 2-3 students coming to me asking, "What can I do? What can I do tomorrow? Can I do research at your department?" That makes me that you see starting a session and people like us against someone about sustainability, but actually giving them the basics to think about themselves, what they believe is the rightful thing to do, then really often they come back to you and they're highly motivated, and that motivates me a lot.
If I may rephrase the question of many students that ask you. When, after listening to this podcast, if I'm now motivated to get a bit more into this topic, can you give me advice where to start reading, for example, how to get into this?
Well, The Lancet has an annual report called the Lancet Countdown. This is a report about healthcare and climate change and how climate change negatively affects health. Reading this report is not fun.
For sure not.
I would not recommend it if you're in the mood for some light literature, but it is the best report probably on this topic. So yeah, start there, I would say.
And it gets renewed every
year. And there's also a web page which you can flick through some faster facts, which make it even more easy to process.
Yeah, and then you have the Lancet Planetary Health, which is an own sort of sub-magazine with different subjects in it as well. That is very good. The WHO has good literature about it to start with. Also the human health and environmental impact and climate change is quite clearly explained on the website of the WHO. There are a lot of podcasts about it as well. But if you're, for example, want to become a gynecologist, because that specialization hasn't come, we haven't talked about yet. A lot of specializations and societies, Human Society of Gynecology, for example, they have a sub-page for sustainability or climate change, and there you find the specific studies needed or their standpoints, and that can also guide you further. I think that helps. And Healthcare Without Harm has also some good overviews.
Yeah. In the Netherlands, we have multiple networks as well. We have the Groene Zorg Alliantie. I'm apologizing to all the international listeners for my Dutch words here. But and we have the Groene OK, which is more regarding green surgery. Well, there's and these platforms all have multiple topics about where you can read into further projects.
And for students especially, I would think about IFMSA again, or the European Medical Students Association. They do have policy papers and standpoint papers on this as well. Always a good starting point. Read through those, look at their sources again. For sure, the Lancet will be one of them. So, like that, you can start.
Very good advices, I guess. And also then remember again the motivation that you get back after reading those doom scenarios in different literature. Then you know all the background, and to get your motivation back and get your optimism back, you can join groups that are already working on this, connecting to people. I think that's what you both said. What gives you the energy to keep up doing this and keep up fighting for it, be part of the solution, as you put wonderfully.
Absolutely. Yeah, I think this subject is an emotional one. It is not easy to indeed read about all the doom scenarios, but it's important. And actually turning it into motivation is the best thing I could have done.
Yeah.
Yes, and talk about it, I would say. So if you feel anything, speak about it with other people, share your ideas. And I think in that sense, you can, help each other.
I think this is a wonderful note to end on. Very motivational talk, in my opinion. We didn't cover too much of the specific contents, but you guys can all read it up in the Lancet and in all the other literature that is out there. We might make a couple of more episodes on this topic, because I think we can talk many days, hours, months about this topic, also in more detail on specific subtopics of this. But thank you both so much for your interesting views on this and all the explanations.
Thank you for having us.
Yeah, thank you for inviting us.